Coccydynia, the painful condition most people have but never heard of by name. Pain at the base of the spine that gets worse when you sit, when you stand up from sitting, or during certain activities and you've been told to sit on a cushion and it will pass. If that's been your experience with coccyx pain, this episode is worth watching and is directed for you. I'm Steve Carter from Male Health Clinic here in Beeston, Nottingham. Coccydynia is pain in and around the coccyx or tailbone. It's a condition that is often dismissed or undermanaged. I want to give you a proper explanation of what it is. The coccyx is a small triangular bone at the base of the spine. Coccydynia refers to persistent pain in that area. Common causes include direct trauma, a fall onto the base of the spine being the most obvious. But it can also develop from prolonged sitting on a hard or poorly designed surfaces, from repetitive strain, from childbirth, or sometimes without an obvious cause at times. The pain typically worsens when sitting, with a transition from sitting to standing and sometimes during defecation or sexual intercourse. It can be a dull ache or a sharp pain, localized pain as well. It's more common than most people realise and significantly more disruptive to daily life than it tends to be taken seriously. Coccydynia is frequently dismissed for a simple reason. X-rays and standard imaging often look normal or show only minor changes that are considered unremarkable. When imaging looks normal and the condition isn't well understood by the treating clinician, the result is often a combination or recommendation to wait and see or use a cushion. For some mild cases, that's enough. For persistent, significant coccydynia, it's not. And the longer it gets untreated, the more it affects daily function, posture, and quality of life. Proper management of coccydynia involves a thorough assessment of the coccyx itself, the surrounding muscular tissue, and the pelvic floor, which is often involved and often overlooked. Treatment typically includes manual therapy to address tension and restriction in the local muscles and connective tissue, pelvic floor rehabilitation where indicated, or target interventions depending on specific presentation. Shockwave therapy can also play a role in reducing localized inflammation and promoting tissue healing. For most men with persistent coccydynia, a structured course of treatment produces meaningful improvement. It doesn't have to be a permanent fixture. If you're managing coccyx pain with a cushion or hoping it resolves, it's worth getting a proper assessment. There's usually more that can be done. So subscribe for more men's health content below, or visit our website for an informal chat and click the link in the description